Hi, this is Dr. Corey Maas on Looking Your Best. There are a lot of questions about defining certain anatomic areas of aging and just things we might be born with in terms of the use of products and technology that we have now, whether they be lasers or cosmetic injectables or even surgery. And there are many minor procedures and minimally invasive procedures that are available for improving some of the contour changes, often referred to as smile lines. So the nasolabial fold, for example, something that sags, the marionette lines, loss in the contour of the jawline where there's a bump like a jowl on the side. And so when we define these things, especially as it relates to things we can do in the office, I like to think of them in terms of fine lines, or in this case, really softening some of the transitions that occur in the face between the cheek and upper lip, for example, or the lower part of the cheek and the lower lip, or even the jawline changes that occur in general principles. There are also the options of doing some augmentation or improving contour of the cheekbone area. And these are a little bit different and distinct from just restoring volume, which we'll get to in another session. But when we're talking about smile lines and facial contouring, it's really about targeting these areas, the nasolabial fold. And they really early on, they're best treated with some type of filler. Frankly, all of the cosmetic injectable fillers are fairly effective when used properly and correctly. And most of the cosmetic fillers that are available today were studied actually in that area specifically. And so the FDA, or the Food and Drug Administration, created sort of a pathway, or at least the company seeking approval created this pathway for studying these cosmetic injectable fillers specifically in this fold between the nose and the corner of the mouth, which all of us get to a greater or lesser extent depending on the two factors that we talk about that cause this, which is genetics and extrinsic aging. And extrinsic aging is, again, about sun damage and smoking, diet, and exercise, the thing that keeps us healthy, those things that keep us healthy, or that we can prevent to some extent. And then the genetics of it are your skin elasticity and how much your skin is able to maintain its stretch back ability. But all these things are under the forces of gravity. We're all subject to these changes. So for better or worse, gravity is going to grab us sooner or later in life. And if we can minimize those extrinsic changes, all the better. When you start to see these changes that are deep, and again, I tell a lot of people, particularly for the fold, that's a natural anatomic boundary. We don't want to see zero transition between the cheek and the lip. It looks odd if you really overfill that area. But when it's a feature of the face that when you look in the mirror appears to be a prominent feature, in other words, it's too much to make you look youthful and natural, that's when one of the cosmetic fillers can be very helpful. That's a simple procedure that can be done in the office. In the early days, we were using things like Restylane and Radiesse, and now there's newer fillers like Velour and Volift, and the Restylane Define and Refine. There's a list of them, and all of them are very effective when applied correctly. There are certainly differences, which I would encourage you to talk to your physician about, in their performance as it relates to their softness or pliability, their duration of effect, which is a big issue, really. That's the things that have really changed, that we can get some of these fillers lasting out to 18 months or longer with a single treatment, which is exciting. So we start to learn more about the Botoxins or the botulinum toxins lasting for a year or longer in proper dosing. We're starting to now get more fillers that are out for a year or longer in duration. So typically that's done in a 15-minute or so office procedure when we're talking about the nasolabial fold. We don't want to overtreat it. The original Juvederm XC is an excellent product because of its water-retaining capacity, so you get some enhancement or loss of that severity of the transition. And we're talking about how the fold sort of slopes severely to the lip, and we want to soften that transition. It's the same thing with the marionette line here. We can do small things to soften the transition or even completely eliminated with a combination of both fine line fillers and then some of these other deeper fillers that we're placing below the dermis, below the skin surface itself, to lift everything up. But typically in that marionette line area, the deeper fillers, the ones used below the skin surface alone, are not going to completely correct it. So it's some combination of a little bit deeper filler and a little bit more superficial in my practice, and if we're going to stay minimally invasive. And those other areas that I mentioned of contour change include the cheek area. I really like fat transfer for that, but there's downtime, there's donor site morbidity. So unless we're usually doing another procedure like a facelift or an eyelid surgery or some other cosmetic lifting, a minimally invasive cheek lift, a percutaneous mid facelift as we like to describe it, I typically don't go to that as a first line product. The best studies that include the mid face were done with the Juvederm Voluma product, but the Radiesse product works very well, which is microparticulate, and some of the newer Allergan products like Velour may be good examples, or Restylane Lift, another good example of a product that has excellent duration and is very versatile in these applications for improving the deep groove in front of the jowl bump and softening the bump, therefore. I would say the future of this may be in facial contouring, may include using the newer medication deoxycholate or Kybella in the face, and this would be completely off-label, but using that in small, tiny little aliquots to decrease the bump here or little areas of excess fat. It has to be very judicious, and we're still concerned about nerve injury or nerve weakness when applying these the Kybella, the deoxycholate product, in the face. And so that's on still the experimental side, but very promising early results for treating the jowl bumps, just as we've seen in the treatment with cellulite for reducing in very small amounts the fat of the face. Generally speaking, when we're improving facial contours, we're using facial fillers, and we can choose minimally invasive options like Ultherapy, which is ultrasound treatments for the face, that microfocus ultrasound treating the deeper fascial layer, or doing suture lifts like the Silhouette lift, which is a series of absorbable sutures that are applied with small cones on them below the skin surface along the jawline or cheek, or the percutaneous single point lifting that I've described using an EPTFE or Gore-Tex suture with a small anchor on it. So those are procedures that can be done in the office or simple outpatient procedures in an outpatient facility as long as sterile technique are maintained. But those are a little more invasive. They're slightly surgical. I'd call them minimally invasive surgery, and are a step up, if you will, for those that they're indicated in. And we have other options to take a look and see how we do that. But in this situation, talking specifically about contouring with small injectable filler concentrations that are in these transition zones, the marionette line, nasolabial fold, cheek areas are best examples, are best done with a surgeon or a physician, with a dermatologist with experience in these areas that understand the anatomy and are softening those transitions to not make you look blown up or puffy, but to enhance the natural contours of your face and to soften some of those transitions that are associated with aging or tired look. So if you have more questions about these areas, about facial contouring or softening transitions, as we say in the face, please don't hesitate to write at drmaas.com. As always, we like photographs and videos, which we'll keep your identity secret, or you can do it publicly if you choose. And we'll talk about you specifically and the options that are available. This is Dr. Corey Maas on Looking Your Best.